Hello, and welcome to the COVID-19 Telehealth Program Application Process webinar. My name is Jesse Jackman. I'm a legal advisor in the Wireline Competition Bureau of the Federal Communications Commission. In the order adopting the COVID-19 Telehealth Program, the Commission directed the Wireline Competition Bureau, working in coordination with the Connect to Health Task Force, to review applications for funding. This slide deck provides a walkthrough of the application process for the FCC's COVID-19 Telehealth Program online application portal. At the end of the presentation, viewers should know how to access the application portal and submit an application to the Commission for the COVID-19 Telehealth Program. For a little background, on March 27, 2020, President Trump signed the Coronavirus Aid, Relief, and Economic Security Act into law. It's also known as the CARES Act. The CARES Act appropriated $200 million to the FCC to support healthcare providers' use of telehealth services to combat the COVID-19 pandemic. On March 31, 2020, the FCC established the COVID-19 Telehealth Program to implement the CARES Act. The COVID-19 Telehealth Program will provide immediate support to eligible healthcare providers by fully funding their telecommunications services, information services, and devices necessary to provide critical connected care services until the program's funds have been expended or the COVID-19 pandemic has ended. The COVID-19 Telehealth Program Order was released by the Commission on April 2, 2020, and is available at this link here. Question: who is eligible to receive funding? The COVID-19 Telehealth Program will be open to eligible healthcare provider sites that treat patients, whether located in rural or non-rural areas or U.S. territories. The COVID-19 Telehealth Program is limited to nonprofit and public eligible healthcare providers that fall within the categories of healthcare providers in Section 254H7B of the 1996 Telecommunications Act. 1. Post-secondary educational institutions offering healthcare instruction, teaching hospitals, and medical schools. 2. Community healthcare centers or health centers providing healthcare to migrants. 3. Local health departments or agencies. 4. Community health centers. 5. Not-for-profit hospitals. 6. Rural healthcare clinics. 7. Skilled nursing facilities. Or 8. A consortia of healthcare providers consisting of one or more entities falling into the first 7 categories. For purposes of the COVID-19 Telehealth Program, which is authorized by the CARES Act and not the 96 Telecommunications Act, both rural and non-rural healthcare clinics are eligible to receive funding. The Commission's prior interpretation that dedicated emergency rooms for rural for-profit hospitals qualify as public healthcare providers and rural health clinics extends to the COVID-19 Telehealth Program. For additional information, please see www.fcc.gov/document/rural healthcare support mechanism 8. For purposes of the COVID-19 Telehealth Program, which is authorized by the CARES Act and not the 1996 Telecommunications Act, we extend this interpretation to include dedicated emergency rooms of non-rural for-profit hospitals. There are 3 key steps to file requests for funding. The 3 steps are outlined in this slide. 1. Obtain an eligibility determination for each site on the application from the Universal Service Administrative Company, or USAC, using the FCC Form 460. This is a separate application. Applicants that do not yet have an eligibility determination from USAC can still file a COVID-19 Telehealth Program application with the Commission while their FCC Form 460 application is pending with USAC. The form is available on USAC's website at this link here. Question: if I already have received an eligibility determination for the FCC's existing rural healthcare programs, do I need to obtain a new one? No, you do not. If you have already been deemed eligible to participate in the FCC's existing rural healthcare programs, you can rely on the eligibility determination for the COVID-19 Telehealth Program. 2. Register for an FCC registration number for the applicant in the Commission Registration System, which we call CORS. The link is here. As I will explain later in this webinar when discussing the certification step, Applicants need the person certifying the application to be registered in CORS. A new FCC registration number is not required, as an existing FCC registration number may be used. However, if using an existing FCC registration number, make sure that it is associated with the CORS account of the person certifying the application. Also, for consortia, the portal allows an applicant to include multiple healthcare providers on the application. An FCC registration number is required for each healthcare provider in the consortium. And this presentation goes through step 3, submitting an application for funding through the COVID-19 telehealth program to the Commission through the Commission's online portal. In addition, to receive payment, applicants must register with the System of Award and Management. We strongly encourage applicants to start this process before they receive a funding decision. To do so, visit www.sam.gov/SAM. The COVID-19 telehealth program application portal will open Monday, April 13th, 2020 at 12 p.m. Eastern Time. Question: is there an application window or deadline? No deadline has been set for the filing of COVID-19 telehealth program applications. Applications may be filed beginning at 12 p.m. Eastern on April 13th, 2020, and will be accepted on a rolling basis. The Commission will continue to receive and review applications and make funding decisions until the funding is exhausted or the current COVID-19 pandemic has ended. To access the online application portal, go to this link here: www.fcc.gov/COVID-19-telehealth program. There, you will find another link to the application portal. After clicking that link, you will be directed to a login screen. Enter the CORS account username and password. Once logged in, you will see the portal's landing page. Again, you will need to log in under the CORS account of the person certifying the application. This is the portal's landing page. At the top here, you will find the filing instructions, a link to the program's webpage, a link to guidance on the application process, and an email address for general questions about the program. Click Start a New Application to start a new application. The applicant is the entity submitting the application. In this area down here, you will see this table. In the table, the logged in CORS account user will see all applications created under that CORS account. A CORS account or an applicant can have multiple FRNs associated with them. In this table, you will also be able to see when an application is in progress, meaning you are still working on the application, or submitted, meaning the Commission is reviewing the application. The status of the application will show as submitted until the Commission has made a decision to approve or deny the application. If your application needs additional information, the portal will indicate, and a Commission application reviewer will contact you. You may need to revise your application and or provide additional supporting documentation. Step 1. This step seeks information about the entity submitting the application. Enter the information in the relevant text boxes or using the drop-down where provided. Fields marked with an asterisk are required. The application process will include helpful instructions about each field. You will see at the top here other application steps identified as tabs: contact information, services and conditions, purpose and intent, funding request, and certification. Clicking the step or tab will bring up the information you need to fill out. You do not need to go in order. Step 2, contact information tab. This step requires that you fill in the contact information for the person submitting the application. If needed, this is the person whom the Commission will contact if there are any questions or issues with the application. So make sure that someone is readily available at the phone number and email you provide. This does not need to be the person certifying the application. Step 3. This step, not one of the tabs, requests information about the healthcare provider or providers included in the application. Before filling out the healthcare provider information, which is at the bottom of the page beneath the tab sections, you must hit Save. There is a notice at the top of the portal that explains this. The screen will refresh after hitting Save. Applicants will click on the New button on the left-hand side. That will pop up the window on the right where you can input the healthcare provider information. Enter the information using the text boxes or drop downs. When done, click Add. Complete this process for each healthcare provider that is part of the application. For instance, if applying for a consortium, include an entry for each healthcare provider. Step 4. Services and Conditions tab. This step requests information on the telehealth services that would be provided and the medical conditions that would be treated using program funding. Check all the boxes that apply, and in the text box, provide any additional information on the medical services to be provided. Provide the remaining information requested using the drop-down, check boxes, or text boxes. Remember that fields marked with an asterisk are required. Step 5. Purpose and Intent tab. This step requires information on the intended use and purpose of the COVID-19 telehealth program funding and the geographic area and population served. Other than the one drop down here, these are all text boxes. A tip is to draft your responses in a separate Word document and then copy and paste that response into the relevant text box. Step 6. Funding Request tab. This step requests the total amount of funding and seeks information on whether requested devices are integral to patient care, for patient health, for patient or healthcare provider use. Use the drop-downs and text boxes. Step 7. Applicants are required to provide supporting documentation to show how they arrived at their costs. Such supporting documentation should summarize the expected costs of the eligible services and devices requested and may include documentation, such as an invoice or quote from a vendor or service provider or similar information. Such information should be specific enough to identify line items to facilitate swift review of the application, and we encourage applicants to include information such as a description of the service or device, its eligibility category, the quantity ordered, the upfront and monthly expenses, and the service dates for recurring services. For additional information on the funding request component, refer to the instructions. In order to ensure that as many applicants as possible receive available funding, we do not anticipate awarding more than $1 million to any single applicant. To upload documentation to the portal, click the paperclip icon in the upper right corner. You will get a pop-up window. Then select the file saved on your computer that you want to upload. Uploaded documents are shown at the top of the page, and you can remove an attachment if needed while the application is in progress by clicking the X next to the file name at the top of the screen. There is no limit to the number of attachments you can upload. Applicants can optionally provide details on the Funding Details tab, which will be that at the bottom of the screen. Step 8, Certification tab. This is the step where you certify and submit the application. When submitting an application, applicants are making several certifications concerning their participation in the program and the veracity of the information being submitted. When you are ready to submit the application, enter the certifier's full name here, click the Submit button, then confirm once prompted. Note that the user logged into the portal must be the certifier. Accordingly, it's important that the person certifying the application be registered in the FCC's registration system I referenced earlier. You cannot submit an application that is missing required fields. If you try to do so, an error message will appear. After submission, you will then see a notice confirming receipt of the application at the top of the page. The application will also appear on the Submitted tab on the landing page. You may currently export a PDF, but it's not a complete copy of the application. The ability to export a full copy of the application will be added to the portal at a later date. As you go through the application, you will see this Save Draft button in the bottom left corner. At any time, you may click Save Draft, and it will save all information provided up to that point. When you are ready to start working on the application again, you will access the saved application on the portal's landing page. Again, one thing to note, before filling out the healthcare provider information, you must hit Save to save the application. Providing complete and thorough information in your application, particularly documentation to support your costs, will facilitate the review process. Applicants can view the status of their application on the portal landing page. If the Commission needs additional information, the request will appear on the portal's landing page as well. Our goal is to select applicants that target areas that are hardest hit by COVID-19 and where the support will have the most impact on addressing healthcare needs. The Commission, working with the Commission's Connect to Health Task Force, will make funding determinations and notify applicants. Question: how quickly will applications be processed? Applications will be reviewed as they are received. Commission staff will reach out to applicants for follow-up information if they have questions. Again, to facilitate the application review process, applicants are encouraged to provide complete, thorough information in their applications. The date and time of your application is not determinative of whether you will receive funding. Funding decisions will be made on a rolling basis, however. The Commission will continue processing applications until the funding is exhausted or until the current pandemic ends. Again, to receive payments through the program, applicants must be registered with the System of Award Management. For questions about this application process, email telehealthapplicationsupport@fcc.gov. For general questions about the COVID-19 telehealth program, email emergencytelehealthsupport@fcc.gov. Finally, general information and FAQs are available at www.fcc.gov/COVID-19 telehealth. Thank you for your time. This concludes the webinar.